Hi everybody, this is Venk with Always On EM. As you know, I'm in Las Vegas. I ran into Emma here. I'm really excited to learn more about you and your work. Emma, take it away.
Yeah, so my name's Emma Lantos. I'm actually an OBGYN here, and I came to talk about my poster here in our project here, which is called As Good as It Can Be Given the Circumstances, and we're looking at emergency medicine physicians' perspective on care for early pregnancy loss in the ED. So I just finished my family planning fellowship at USC and did this project with faculty at USC as well as the University of Washington. And what we were really interested in looking at was early pregnancy loss or miscarriage management, particularly in the emergency department, and particularly looking at emergency medicine physicians' perspective on the care that is provided. So a little bit of background. Early pregnancy loss, which again, I will be calling it, but synonymous to first trimester miscarriage.
Okay.
Is common. It occurs in about 20 to 25% of pregnancies. There is data out there on patients' perspectives on their experience of miscarriage in the emergency room, and overall they they report negative experiences often with miscarriage in the emergency room. With that said, they do frequently go to the emergency room for miscarriage care, often because they experience bleeding very early in pregnancy, often prior to establishing care with their OBGYN. And
I'm sure it's just scary.
yeah, super scary.
Yeah.
And they just kind of want answers, and they have reported that they often have to wait a long time, which is a common problem in the ED, not something that you guys are new to. They often have unclear or receive unclear diagnoses, leave not really understanding what's going on, and have reported a lack of empathy from their providers. And guidelines for what you guys should be doing as emergency medicine physicians on miscarriage are kind of lacking. So we really just wanted to talk to you guys in terms of what you think you should be doing, whether it's going well right now, whether there are things that could be better. So we did a qualitative study we interviewed 24 emergency medicine physicians over the course of about a year, all across the country, trying to get people from academic as well as community settings in states that are both have laws that are abortion restrictive as well as abortion permissive, and then both in urban and rural communities, just to try to get a sense of what people are feeling out there. So to jump to kind of what we saw, we found that while early pregnancy loss is often perceived as an emergency for patients, there are lots of systemic stressors that make it hard to manage it well in the ED. And those include boarding, just time and space issues in general, and then competing acuity with other things. So you guys often have many emergent things that you need to deal with, and sometimes miscarriage kind of falls down on that list. But despite that, many emergency physicians believe that there are many parts of early pregnancy loss care that do belong in the ED, particularly diagnosis and counseling. So one provider here just said, when asked how he felt about the one talking about a diagnosis with a patient, he said that that's just my job. It doesn't matter how I feel. I'm the one to do it. She's my patient, and we should take ownership and make that diagnosis for them.
Yeah.
And then lastly, EM physicians are also interested in learning more about kind of management options, both about counseling on those management options as well as the possibility of medication management. So as you may or may not know, there are 3 options for miscarriage management. There's expectant management, which is kind of not really doing anything, going home, passing the pregnancy by yourself. There is medication management, which is 2 medications you can give in the emergency room. And then there's procedural management, which is a manual uterine aspiration. While people were interested in the idea of learning more about manual uterine aspiration, a lot of people actually felt like that took too much time and resources to realistically be able to be done in the emergency room, although there's differing data on that, but that's kind of what we found. But medication management was kind of a quick option that people were a little bit more interested in learning more about. So in conclusion, I would say that EM physicians acknowledge that there is room to improve care for early pregnancy loss in the emergency room, that they are trying really hard, but that there are limitations. and that those limitations really include competing acuity, overcrowding, and difficulty obtaining follow-up for patients to improve care. But despite those barriers, there's a lot of interest in learning more about counseling as well as management options to improve physician self-efficacy and patient satisfaction.
Well, thank you so much for presenting this. For a lot of people, this could make a big difference, especially if we become more comfortable as a specialty with it. And it's unfortunate if patients aren't getting a great experience when they probably need it very, very significantly.
I hope so. And
yeah.
it's a big thing, and there's lots of little things that can happen within it. And I am interested in kind of cross-specialty collaboration in any way that we as OBGYNs can help you guys.
We love that. We absolutely love that. Thank you so much, Emma.
Yeah.
I hope you're having a great time here in Vegas. Thanks for taking the time to share your work.
Yeah, thank you so much.